I was asked to go to the Amen Clinic to see if we could really test this under some scientific measurements. We went and I had a SPECT scan done. On the first scan, the first day, I had no medication at all, no Adderall, no AdCare, either one. And on the SPECT scans, it actually shows on the frontal portion of my brain there's deep pockets, which is basically showing that my brain is sleeping and I am not able to focus. The brain's kind of like a muscle. It'll kind of basically flex, and it's not flexing. So that first one, there's real deep pockets. On the second day, I came back and I was on the AdCare. And the AdCare, it showed a real big difference compared to the first. The pockets were almost completely gone. On one side of the brain, the right side of the brain, it was significantly better. The pocket was almost completely gone. On the other side of the brain, there was still a pocket showing. It was better, though obviously better than previous, and the whole brain overall looks much fuller and more supple and basically like a muscle contracting. And the third day I came in, and that was when I used the Adderall instead. And you could tell the Adderall works and it does its job. There was a significant difference on both portions of the brain in the front. There was still some pockets there, and definitely not 100% better. Maybe slightly better than with the AdCare, but overall, with the side effects of the Adderall, it might be one of those things that it weighs out better to not have the side effects than 100% performance, which I still am not getting on the Adderall. There's other portions of the scans where it shows the internal portion of the brain, and on those you can really tell the difference as far as what's going on in the brain. The first scan, when I was not taking anything, showed a lot of white area in the frontal part of the brain, and then not very much in the rear portion of the brain, which is actually the opposite. It should have lots of white in the rear and not any in the front. Basically, the front areas of the brain lighting up white like that means that I'm having some depression and anxiety and unable to focus, and which kind of plays hand in hand. And that's without any medication. On the second day with the AdCare, I showed a significant difference on the internal scans. The rear region of the brain showed much more light up of white, which shows increased dopamine, which is really very good for focusing and concentration and task management. And the front portion of the brain, there was much less of that white matter, which means decreased anxiety, decreased depression symptoms going on, which is a significant difference for natural homeopathic medication, basically, or not medication, but supplement. And it's a huge significant difference from the first scan with nothing. On the third scan, the internal results with the Adderall wasn't nearly as good as with the AdCare. It did show some improvements, but there was still some white areas in the front, a little bit more than we would have liked to seen. Not as much of the white lighting up in the back with the dopamine. So as far as the internal scans, it was not quite what you would think it would be for a prescribed medication that causes side effects that it can. As for with the scans, each day I did a ADD test, basically a performance test. And on the first day, I had missed quite a few. I think it was somewhere near 15 items. That was with no medications. On the second day with the AdCare, I missed merely 4 of the test problems. And on the third day, I missed somewhere around 11. So obviously the AdCare, as far as task performance, exceeded my Adderall that I had been used to taking by almost twice as good as the Adderall, which is pretty significant, especially without those additional side effects. As far as my recommendation, I would completely recommend the AdCare, especially for anyone who is reluctant to go onto a medication that is a controlled substance. Usually you have to go to the pharmacy every 30 days and have a new prescription, see physicians every month, sometimes every couple months if you're lucky, and have side effects long term, and sometimes have to have written notes for jobs of why you're taking a stimulant. There's a lot of extra additional side effects and loopholes that are difficult when you're taking a controlled substance that is a stimulant. I would definitely recommend AdCare, and if anyone is interested in learning more about it or trying a sample, you can go to add-care.com. One last thing before I say goodbye, I do want to let you know that I am not affiliated with the company, AdCare. I'm not being paid by this. This is totally voluntary. And I am hoping that people will try AdCare, and thank you.